Thank you, Scott. Together with me, I have Dr. Peter Foss, the new Executive Director of Endori Institute at Tradition. We're here to present briefly our research results on the developments at Tradition and the economic development potential, as well as the healthcare economic potential at Tradition. We were commissioned by the Southern Mississippi Planning and Development District, along with the University of Southern Mississippi, to look at the economic issues and specifically diabetes and obesity issues in Mississippi and how the development at Tradition can go a long way to marrying the two to bring about positive economic results. This is the planning vision. Hopefully you can take a look at some of the pictures up close because it's quite tremendous what's happening and the vision for what will be happening at Tradition. Our job was to look at the potential for the economic upswing and growth, bringing together higher education and the potential for a full-blown life sciences cluster at Tradition, which would result in high-wage industries and address the issues of the problems in Mississippi derived from obesity and diabetes, in particular low productivity and low participation rate in the workforce. One of the things we took a look at, our firm, along with the American Legislative Exchange Conference every year, ranks states on their economic performance to date in the last 10 years and what we think our outlook is. And I stopped on this slide because we rarely see such a gulf, and I mean gulf, between your rank and your outlook. And in Mississippi, unfortunately, we've ranked you 44th, that's worst, but our outlook is significantly better. Well, why? As you've talked with your site selection folks, you know that there are a lot of things, including good climate down here, that contribute to a very positive economic climate. But what I want to focus on here are those things that are the problems we need to overcome and how Tradition can add to those. So we talked about a lot today, lack of industry diversity. Well, none of these things in the bullet points happen by themselves. You're not going to get industry diversity without both investments in business and, in the case of Tradition, investments in your health care, as you've been talking about today. Specifically, we focused on diabetes and obesity research. There is a very strong correlation in all 50 states between diabetes and obesity and productivity rates among workers and poverty rates in the states. So if you can reverse the incidence of diabetes and obesity in your state, you're going to bring up your productivity and help you expand and diversify your economy. We also talked about the Gulf Coast region specifically, and as you know, the Gulf Coast region has had more than its share of problems in the last 10 years, including Katrina and the BP oil spill. So Mississippi has great potential, it just needs to be unlocked. Dr. Foss is going to talk specifically about the prevalence of diabetes and the economic cost of diabetes before I get into the results of our economic development potential study for Tradition.
Thank you very much. Good afternoon, everyone. Hope you're enjoying your meal. I'm here to tell you really some of the costs that diabetes affects Mississippi. It costs about $3.5 billion a year because of obesity and diabetes together. And it's important to understand that 15.4% of the adults in Mississippi have diabetes. That's about 400,000 people. Another 800,000 have prediabetes. So you can see the impact. And for a person who has diabetes, their direct medical care costs are 2.3 times higher than anyone else. So the diabetes is really an economic engine in the wrong direction, and the cost to including opportunity costs, et cetera, is $3.5 billion. So it's not just a disease that we should take care of for people's wellness, but it actually has an economic impact that we need to correct.
So the developments at Tradition are crucial to improving Mississippi as well as the Gulf Coast economies. I want to tease up the results of our economic study. These numbers that I'm going to present are exclusive of the economic development potential from any reduction in diabetes. The potential for Tradition over 10 years, just looking at what is happening right now, the planned future development, and the addition of a College of Medicine, we have determined that over 10 years, we can increase the economic impact to the region by 1.3 to almost $2 billion. The developments at Tradition are numerous. If you can look at the slide briefly, the light blue circles show those investments that have already been made in Tradition, including the Endori National Diabetes and Obesity Research Institute presence that Dr. Young talked about this morning, the Memorial Clinic, the School of Pharmacy, and the Nursing School, which Dr. Foss will talk about in a moment. We also have underway commercial and residential development, and planned for the future, and critically important, are the 100,000 square foot facility for Endori, as well as a College of Medicine. These are examples of investments that Mississippi has made, and you're quite familiar with, that have been successful magnets in attracting industry that's diverse and higher paying. In the case of biomedical and medical city developments, I think you heard a lot this morning about some of the other ingredients that you need besides investment, our research institute in conjunction with the College of Medicine. These are some of the partners that Tradition is working with. Dr. Foss, I'd like to talk to you about what's happening at Tradition right now.
It's my pleasure to talk about this because I was involved years ago when this was being planned. But what's happening right now, the latest thing that happened was the opening of the Bryant Center School of Nursing and Simulation Lab for Mississippi Gulf Coast Community College. The significance of this is that Mississippi Gulf Coast Community College had nursing programs at multiple campuses. Now all the nursing students and nursing faculty work under one roof. Right now there's about 800 students there, and it has the capacity to grow to about 1,000. And I think in one of the panels, the Dean of Nursing School at UMC told us about the nursing shortage. So here we have an area which can train more nursing students and have the collaboration of all the people who work there. Also, the School of Pharmacy at William Carey University actually opened about 2 weeks ago, and for a full class. And the significance of that is that they've adopted an accelerated curriculum where students can graduate after 3 years of pharmacy school. And I don't have the numbers, but the pharmacist shortage is just as significant. Also, a Memorial Hospital in Gulfport actually has a clinic now on at Tradition, and which is treating people, and we actually have an endocrinologist. So by the way, there's only 39 endocrinologists in the state of Mississippi. That is the specialist that the primary care physicians will send to. It's only 39 in the state. There's 82 counties in the state. So you can see the shortage that we have right there. And one last thing, talk about the significance of both the pharmacy school and the nursing school will be literally walking distance away, is that it's the same thing that Dr. Young talked about in Cleveland, where they're putting everything on one roof. Well, there's a collaboration and the possibility of pharmacy students taking the same classes in nutrition and epidemiology with nursing students. So the team that needs to be done, that needs to be developed, can actually happen during their education. And forthcoming plan will be sort of the anchor store of the Learning Medical City, and that's the National Diabetes and Obesity Research Institute facility. It'll be 100,000 square feet. It'll be large enough to have basic science, large enough to do clinical trials, large enough actually to treat patients, and it'll be walking distance from the other developments. So a nursing student, a pharmacy student can actually go into the Institute's facility and actually participate in clinical trials, which will make them a much better prepared health professional. College of Medicine, we talked about that a little bit earlier. William Carey has osteopathic medical school in Hattiesburg. There's a plan to have one in tradition, so you might ask yourself, well, why would you need another one? There's one in Oxford, one in Hattiesburg, isn't that enough? Well, just to let you know that Mississippi ranks 50th, and 50 is the worst, in the density of physicians to people. We have less physicians per person than any other state in the union. And the shortage of physicians by 2020, based on AAMC, will be 121,000 more physicians are needed, not just the ones replacing retired physicians. So we need as many medical schools as we need, and this will also fit in again to the Learning Medical City that we built in that tradition. And one last development that we're working on is that Coastal Family Health, which is one of the 21 federally qualified health clinics in the state, which has 13 clinics across the Mississippi Gulf Coast, will eventually move to a facility at Tradition, and also have the administrative offices. They will be treating patients. They serve about 30,000 patients. They will be treating patients that, again, the medical school students can work with, the nursing school students can work with, and the pharmacy schools work with. Because what's happening now in pharmacy is that a pharmacist no longer discounts pills. They actually are part of the healthcare team. Yeah, thanks, you.
We were also asked by Tradition to determine whether or not the development there has the potential to become a full-blown research cluster. My firm has been studying research clusters around the country for decades, and they all have several ingredients in common. We determined that, yes, Tradition does have the potential to become a full-blown research cluster. Some of those ingredients include infrastructure, located on major highway 67, access to airports, of course, desirable climate. Research scientists can decide where they want to live in this country. Low construction costs, low cost of living, it's very important. It's why they're no longer wanting to continue to move to the San Diego area. Other things include patient density, access to clinics and hospitals, and I heard a lot of discussion about that today as well. Here's a couple of examples of research clusters. Of course, the Research Triangle in North Carolina, and you might say, well, how can we ever, become like them? Well, Raleigh-Durham, Chapel Hill wasn't always what it is now. As a more recent example, the Orlando area. I worked with the Lake Nona developers and University of Central Florida 12 years ago on the instigation of Medical City in Lake Nona. And what you see in that picture right now, none of that existed at the time. So I told the folks at Tradition that they've got a jump start on Lake Nona. All of the similar clusters bring about extraordinary growth in GDP, wage growth, and of course, jobs. Don't need to tell you that where you are right now, especially in the Gulfport region, you're lagging the United States in growth, but like the Research Triangle clusters in North Carolina and Lake Nona, you can excel with the Tradition developments if you include the College of Medicine. So in sum, our economic development research found that even without a full-blown research cluster in the next 10 years, that with the developments that are going on in Tradition, along with the College of Medicine, you can increase your number of jobs by up to 7,000 jobs, almost $1 billion in wages, over $1 billion in new GDP, And with a full research cluster, we're talking about $2 billion in additional GDP and over 9,000 jobs. Okay. That's a return on investment to the state in terms of GDP. If the state were to invest $77,000 of either BP Horizon oil spill money or taxpayer dollars, of an over 200 to 400% return on GDP for every tax or oil spill dollar invested, and the state would recoup its costs in 8 to 11 years. None of those numbers, again, take into account what the potential for increasing economic development, not only in the region, but for the whole state, and any reduction in diabetes that results from the research at Tradition. I want to thank you. Thank you for your time today and for a wonderful conference. Thank you, Governor.